Hi, Professor Consent. My name is Pam. I'm a patient advocate manager. First, I want to thank you for meeting with me. I have some questions about the best way to help patients understand shared decision-making and informed consent.
Hi, Pam. It's a pleasure to meet you in person. I've been hearing quite a bit about the outstanding work you do advocating for your patients.
Thank you, Professor. Now, Professor Consent, in my experience, when a doctor is recommending a medical or surgical procedure, they will often explain the reason why the procedure is needed and ask the patient to sign something called an informed consent document. I've noticed it can get pretty complicated and sometimes awkward for the doctor, patient, and even me.
That's absolutely right, Pam. Informed consent is the medical term for when your doctor obtains a signed document from their patient permitting the doctor to proceed with a medical or surgical procedure. This document becomes part of the patient's medical record. However, the doctor's responsibility is much more than simply having the patient sign a piece of paper which lists the procedure being performed and the potential complications of the procedure.
I think I understand what you mean, but can you explain it more? What else is involved?
Well, Pam, to correctly receive a patient's informed consent, the doctor must adequately educate the patient so together they can share in the decision-making process. The doctor has a moral, ethical, and legal obligation to make sure the patient has an understanding of the reasons why the procedure is being recommended. Additionally, they should understand what the hoped-for benefits of doing the procedure, along with what some of the potential risks are, as well as what the alternative options are.
I was told that doctors need to also explain any problems which may result from the recommended procedure.
Well, Pam, while that is partially correct, the truth is a bit more complicated. You see, while it is essential that the doctor explain the risks of a procedure as well as the hoped-for benefits, it would be impossible to list and discuss every single possible risk. Instead, it is considered the standard of care for the doctor to review with the patient two broad types of risk. First, if the procedure has a risk of severe harm, such as death, paralysis, loss of limb, and irreversible brain damage. And secondly, risk of complications, although not as serious, but which are more frequently associated with the procedure, should be reviewed with the patient.
I've noticed that some doctors quote statistics when describing possible risks.
Well, Pam, every doctor has their own unique style to educate and inform their patients. Statistics can certainly be a helpful tool, but they have certain limitations. Statistics look at the outcomes of a particular procedure performed on a large number of patients. For example, if a patient needs a cardiac catheterization, their doctor may tell them that based on the medical studies, there is a risk of approximately 1 in 1,000 of suffering a stroke as a complication of the cardiac catheterization. However, because all people are different and every possible risk factor cannot be accounted for in the medical study, the resulting statistics can only give us a rough estimate of the actual risk. Even more importantly, statistics can tell us the chance of complication.
I'm still not 100% clear about risk versus prediction.
Well, imagine we have 10 boxes. In 3 of those boxes, we place a black piece of coal. We then give 10 different people each a box. We know statistically that each person has a 30% chance of opening their box and finding a piece of coal, but we can't know who will actually get the piece of coal.
I think I see now, Professor. Statistics can tell us the likelihood that something will happen or not, but it cannot predict who that something will happen to. So, in the case of cardiac catheterization, the statistics were 1 in 1,000. That's like 1,000 boxes with just one piece of coal.
In addition, it's important to keep in mind that probability can be affected by certain risk factors, such as smoking, obesity, high cholesterol, and hypertension. In our analogy of the boxes, one could say now that in a group of patients with some of these risk factors, that instead of 1 per 1,000, the risk would increase, and now might be 4 in 1,000.
Now, Professor, I've noticed that some patients want their doctor to decide whether to go through with a procedure.
Well, Pam, the weight of that decision can be pretty heavy sometimes. Some patients don't want to be responsible for making the wrong choice. They prefer their doctors to make the best, most informed choice for them.
Another thing I've noticed is that a lot of my patients and their families ask their doctor, "What would you do if you were in my shoes?"
Well, Pam, as is often such in life, there is no right answer. What I can tell you is a doctor must avoid using his own feelings and bias in order to not interfere with the patient's decision-making. For instance, Pam, I often tell my patients that we are all different, and each of us has our own beliefs and ways of looking at the world. The decision I would make should not affect your final decision. The role of your doctor in this shared decision-making process is to educate you so you can make the decision that is the right one for you, and your doctor will support you in your decision.
Thank you for explaining informed consent and shared decision-making to me, Professor Consent. All this information is definitely going to help me to be an even better advocate for my patients.
My pleasure, Pam. If you have any more questions, feel free to visit me again.